Good morning, everyone. Today we are going to discuss about newborn care, that is essential newborn care. Before moving to the topic, let me introduce myself. I am Ms.Viruthasarani.K, Professor, Community Health Nursing in SNS College of Nursing. Let me move to the topic, essential newborn care. A newborn care is the critical medical and parental care provided from birth to about 28 days of life, focusing on ensuring the baby's survival and healthy transition from the womb. Definition: essential newborn care, the set of strategic and cost-effective intervention provided to all babies from birth through the first 28 days of life to improve their health and reduce mortality. What are the immediate care should be provided by the nurse after a baby is born? That is immediate care of newborn. As a nurse, you have to maintain the temperature of the newborn, and we have to administer vitamin K injection, and we have to take the care of cord, that is umbilical cord. Then the first and foremost thing, it is very important, the nurse should initiate the breastfeeding. In case of normal delivery, the nurse should initiate within half an hour. And in case of LSCS, that is lower segmental cesarean section, it is vary from one mother to another mother. When the mother is recovered from anesthesia, you have to initiate the breastfeeding. Then you have to maintain the airway and circulation of newborn, and finally have to check the weight of newborn. It is very important. Then next thing is I have to check the APGAR score. What is APGAR? A stands for appearance, P stands for pulse, and G is grimace, and A again activity, and R is respiration. How to check? Here the picture is depicted in various score. The total body is blue, it indicates 0, and the um, extremities alone blue in color, we have to give score 1, and the whole body and extremities, it is in a pink in color, we have to give 2. And we have to check the pulse. There is no pulse, you have to give 0, and less than 100 score 1, and 100 to 140 have to give score 2. Then grimace, that is facial expression of the newborn. The newborn is not responding anything, that is 0, and they are crying, that is very slowly. The newborn is expressing a weak crying, it is score 1, and it is crying in a normal tone, and the full-fledged the baby is crying, that is baby, that is we have to give score 2. Then activity, that is how to check the tone. There is no movement in both the upper and lower extremities, we have to give score 0. And arm and legs alone flexed, and other body and all they are maintained as a silent, we have to give a score 1. And total both the extremities upper and lower including body, they are in active movement, we have to give score 2. Then coming to the respiration, that is no respiration at all, that is apnea, absence of breathing, have to use score 2. And the child is breathing in very slow and irregular manner, we have to give score 1. And the child is breathing in normal, that is storing crying, the baby is crying, baby respiration is good, we have to give the score 2. So total score is 10. The baby is falling between 8 to 10, it indicates a normal. Below 8, we have to, that is pediatrician should take care of these babies. Next, common neonatal problem. What are the common neonatal problems are there, and how we can console the mother? There are 3 methods are there. One is neonate may have some physical and physiological peculiarities which are of no consequence. They are having some peculiar changes during a newborn period, but it is no harm. That should be explained very well towards the mother. Then only mother is in a calm and quiet mood, and the mother can accept, they can able to understand the things, so we have to explain in a proper way. Then mothers need adequate explanation and reassurance to remove their anxiety. Yes, already we discussed. The necessary advice to given to overcome the minor problems. You have to give the proper advice to the mother. Then only the mother will reduce her anxiety, and she can overcome those minor changes during newborn. So, what are the changes will occur? One is diarrhea, constipation, milia, erythema toxicum, overcrying, caput succedaneum, mastitis neonatum, jaundice, Mongolian spot, vomiting. These are the common disorders during newborn. It is common only. The day will go, it is also disappear. So, first vomiting. Vomiting is, we know, that is forceful expulsion of stomach content. The stomach content is forcefully expelled out. That is vomiting. So, what are the management we have to give? You have advised the mother to adjust the feeding and positioning medications. So, positioning is very important. A lot of mother will not knowing about that breastfeeding technique and position. We should not, as a mother, should not feed the baby in a lying down position in the bed. Mother will sit properly, and the mother will hold the newborn head in the elbow joint, and so various techniques are there. We have to educate the mother about the breastfeeding technique. So it is very helpful. It is very helpful to the mother to give adequate position, a mother to maintain adequate position. Through that, the child cannot vomit anything. So it is very important. Diarrhea. Diarrhea in newborn means more frequent, very loose or watery stool than normal pattern, often three or more watery stools in a day. That is diarrhea. What are the management you have to give? One is hydration, monitor, hygiene. So, advise the mother can feed breast milk adequately, or if the mother is not secreting milk, we can go for the formula feeding. That should mother should make frequently hydrate the newborn by using both breast milk and formula milk. And next is monitor, track with diaper, urine output, and stool frequency. The mother will keep on watch how many times the mother can changing the diaper, how many times the child, that is newborn, is urinating, and stool, how many times the newborn is passing the stools. That and all have to monitor very closely. It is very important. Hygiene, keep baby clean to prevent infection. So always a newborn, any newly born child or newborn in the family, they are making the house in a so hygienic way, and they are not allowed the relatives to hold the baby or take the baby, and they are not allowing very close to the newborn. So that and all very important. It is a good thing also. You have to advise the caretaker and other person, those who are within the house, we have to educate in a very proper way. By that, we have to maintain various diseases. Constipation. Constipation in a newborn is not just about infrequent poops, but rather hard, dry, pellet-like stool that are difficult and painful to pass, often with the crying or straining, even if they are having bowel movement daily. Daily they are having bowel movement, but they are feeling constipation. Because of that, the mother is not hydrating properly, either by a breast milk or by a formula milk. So, what are the treatment? Give your baby a warm bath to relax their bowel. So, always have to give a then only that our aunties and parties and all the every day they're giving very warm bath to the newborn, and alternative days they're giving head bath also. So they are having some reason behind that. Without that, they can't do anything. So we have to give a warm bath every day. So by that, we can able to prevent a constipation. Milia. Milia in newborn are harmless, small white bumps that appear on the face, often on the nose, cheek, chin. Why it has happened? Due to trapped keratin under the skin. So the keratin is stored under the skin. Due to that, the newborn is having the appearance of white spot over the area, verinal, that is nose, cheek and chin. That is milia. Then erythema toxicum, that is erythema toxicum neonatum, is a common harmless skin rashes that affect many healthy newborn within the first few days of life. This is also a normal physiological disorder. It will go after the days, even it take even 7 days or 2 weeks. Okay, we can't do anything, but we can apply that calamine lotion. That is very important. Then not at all needed any treatment. If the mother feel anything, we can advise the mother to apply mild calamine lotion over the body. Then excessive crying. Excessive crying in babies often defined as crying for 3 or more hours a day, 3 or more days a week for at least 3 weeks is commonly known as a colic. The baby is continuously crying in a day, or it is repeating every day, that is 3 or 4 times in a day, we can consult the physician, especially pediatrician. Why? Because the newborn will have any colicky pain related to GI tract. So you have to consult the pediatrician. Next is caput succedaneum. A caput succedaneum is a benign swelling of a newborn scalp that occurs during a vaginal delivery. The mother is forcefully pushing her baby out during that time. The birth canal will give more pressure on the scalp. Due to that, the baby will have a puffy bump swelling over the scalp. That is caput succedaneum. This also go after the days, after a few days. Even it takes up to 1 week. It is a normal phenomena. It will go off normally. Then mastitis neonatum. Mastitis neonatum is an inflammation or infection of the breast tissue in newborn, usually under 2 months old, often arising from the normal hormonal changes, that is maternal estrogen, withdrawal of maternal estrogen. Due to that mastitis will occur. It is also a normal process. It will go off automatically. Why it has happened? Sometime the newborn will have a witch milk in his or her breast. That is after the birth, either it is male baby or female baby, leaking of milk is present in the breast. It is because of that maternal estrogen. So due to that, the newborn will have a symptom of mastitis. It is also a normal thing. Next is jaundice. Jaundice in newborn is a common condition. Why it is occur? After, that is during newborn period, the liver is not mature enough to change to accommodate everything. So what will happen? The yellow pigment is breaking out from red blood cells. Due to that, jaundice will occur. This is also a normal process. If the baby is adapting to the external environment, or if you are showing the baby in the early morning sunlight, it will go off. It is also a normal disorder. Then Mongolian spot. That is as like a small mole, as like the same color, but it occurs over the wide variety of areas. A Mongolian spot, also known as congenital dermal melanocytosis, is a flat, a blue-gray to blue-black birthmark, most commonly found on the lower back or buttocks of newborn. They are caused by melanocytes pigment cells. This is also a normal process. The days go, the spots also go. Okay. Then conclusion. Essential newborn care is crucial for preventing infant mortality and promoting long-term health by focusing on immediate and ongoing practice like maintaining body temperature, initiating breastfeeding, preventing infection, and nurturing the parent-child bond. By maintaining this, we can able to control the minor disorder during newborn. So by providing essential newborn care, that is important newborn care, we can able to overcome or we can able to control the minor disorder during newborn. So by concluding this, I'm stopping my lecture and we will meet in the next video. Thank you. Have a nice day.